Chapter 1, Intro to HealthyU. Healthcare is changing, and health costs are challenging. Usually you buy insurance, then hope for the best that you are covered. But what if your health plan actually rewarded you for being healthy? UPMC HealthyU does just that. It's a plan that offers you reward dollars when you make healthy choices. Reward dollars that are then used to lower your healthcare costs. Making healthy choices means making smart choices. We want you to stay well informed to make the best decisions about your health and care. So we give you the tools to understand and improve your health and offer new ways to help you manage your medical expenses. Your plan also offers a lower monthly premium to meet your needs, access to the top-ranked network of providers, hospitals, and pharmacies, award-winning customer service, a robust online resource center with tools and information on how to stay healthy, free access to self-guided programs and health coaches who can help you lose weight, eat healthier, get fit, or better manage a health condition. Discounts and savings at gyms, spas, sporting goods stores, and health food stores. With great benefits and resources like these, gone are the days of forgetting about your health insurance until you need it. Good health means healthy choices, healthy rewards, HealthyU. Chapter 2, How the Plan Works. HealthyU is powered by MyHealth, our acclaimed health and wellness program developed by UPMC. MyHealth guides and motivates you to live healthier through motivational coaching, engaging online programs, interactive tools, and over-the-phone advice. And as your wellness goes up, your healthcare expenses go down. That's because HealthyU comes with a Health Incentive Account, or HIA. This account is funded by UPMC Health Plan with money you earn by doing healthy activities. You have more than 150 activities to choose from, each with a dollar value. As you or any covered member completes these activities, you can earn up to $500 in your incentive account for yourself or $1,000 for your family. You can then use these funds to pay for out-of-pocket medical expenses such as copays and coinsurance. HealthyU offers more than just an ounce of prevention. Cancer screenings, counseling services, immunizations, and yearly checkups are a few examples. But all preventive care is covered at 100%. You pay nothing for these services, but you still earn reward dollars for them. Except for preventive care, you pay for your medical expenses until your deductible is met. But remember, the reward dollars in your health incentive account will help cover those expenses. Once you meet your deductible, you start paying coinsurance. This is a percentage of your medical expenses, but don't worry, your plan comes with an out-of-pocket maximum that limits how much you pay. Once you reach your maximum, you receive 100% coverage through the end of the year. Finally, your reward dollars roll over to the next year at up to 2 times your annual deductible. That's a lot of healthcare dollars available when you need them in future years. Chapter 3, Get Started Today. HealthyU makes it easy to get information, knowledge, and resources to help you guide your healthcare needs and healthcare costs. You can earn reward dollars and save more money by picking the best healthcare options for you. For example, you can ask your doctor for generic options, review treatment options for your condition and possibly avoid costly procedures, work with a health coach to assist with your wellness decisions, call the nurse advice line if you have a question on any health issue. Our secure member portal, My Health Online, gives you instant access to tools and support. You can earn and track reward dollars, search for a doctor, review claims and spending account balances, chat with a member services healthcare concierge, and more. You'll also find one of our most popular features, the My Health Questionnaire. Answer basic questions about your health and receive a personalized report that you can print and take to your doctor. Your answers also customize My Health Online, so you only get the resources that benefit you most. Take the questionnaire right away to earn reward dollars in your incentive account. Go to upmchealthplan.com and log into My Health Online. New users need to select Member Login, then click New User Registration to set up your account. You'll need the number on your member ID card for this. Your adult family members can also register and complete their own My Health questionnaire. You'll earn reward dollars, and they'll receive their customized roadmap to better health. UPMC Health Plan has partnered with WebMD to offer online health education, decision-making, and price and quality comparison tools. There are more than 200 health topics covering many common conditions, procedures, and alternative treatments. You'll also find online health coaching, helpful videos, and downloadable educational materials. You can choose a UPMC health plan provider based on quality and costs. You can also search our formulary for medications, and we provide you with information on generic drugs and other lower-cost, higher-quality options. My Health Community allows members to easily find hundreds of health discounts and wellness resources based on zip code searches. Finally, you can engage with the health plan via our Facebook, Twitter, and YouTube sites. We designed these to provide you a forum to share questions and experiences regarding healthcare, healthy lifestyle programs, and other health-related topics. HealthyU with HRA. An HRA is owned and funded by your employer, who contributes a fixed amount at the beginning of the plan year. You receive tax benefits because contributed funds are not considered wages, and contributions to your HRA are tax-free. However, you cannot put money into your HRA. HRA funds are automatically applied to eligible medical expenses after you use the available reward dollars in your health incentive account. The incentive account funds first, then the HRA account funds. Money from both accounts can be used before and after your deductible is met. Here's an example of how the two accounts work together for you. Let's say that your deductible is $750. Your employer contributes $125 to your HRA, and you have earned another $300 in your health incentive account by completing healthy activities. Both accounts total $425. If you have a medical test done that costs $350, the $300 in your incentive account applies first, and the remaining $50 comes out of your HRA. So, you pay nothing out of pocket. Plus, you still have a balance of $75 in your HRA and the opportunity to earn another $200 in your incentive account to offset future medical expenses. Here's a second example. This time you have $125 in your HRA and earned $500 in your incentive account, but your procedure costs $700. In this case, the full $625 in your spending accounts is applied, leaving you $75 to cover out-of-pocket. So while you may have to pay occasional out-of-pocket costs, especially until you reach your deductible, you can see how your reward dollars can really lower those costs. Once you meet your deductible, you are only responsible for co-pays and co-insurance until you reach your out-of-pocket maximum, which is the most you'll have to pay in one plan year. At that point, HealthyU pays 100% of your eligible medical expenses, including prescriptions.
All right, that was a general overview just of the HealthyU product. I hope it was fairly helpful for you. I think you get the idea that what we'll have and what you will have is the opportunity to earn money to apply towards your deductible by taking healthy activities. And we'll talk about those in detail now. All right. As the video mentioned, HealthyU is a plan that offers you the ability to earn dollars to pay for all of your out-of-pocket expenses. Preventive care is covered at no cost to you. Preventive care is always covered at 100%. No co-insurance, no deductibles. You have the same access to UPMC doctors and hospitals, all of our physicians. If you can go out of network, but your out-of-pocket costs will be higher, and that's no change to what it is now. UPMC's customer care concierges, as always, are available to you. And we also have access to My Health, and we'll talk a little bit about that as well. My Health is our online health and wellness program. Why are we doing this? Well, we're doing this, the conference in UPMC, feel that healthy choices equal smart choices, that people who are informed, members who are informed about their health and understand a little bit about their health in their lifestyles, make better decisions about their health care. Medical costs are impacted by your lifestyle, by your choices. There are some things you can't hide from. Some things just happen to you. But much of the healthcare costs incurred by the conference are really the result of individuals' lifestyles, your choices, how you live. We're trying to give you the tools and give you the support to make good choices. There's the My Health Online and the questionnaire. We'll talk in more detail about those. You also have available to you decision-making, price, and quality comparison tools through the WebMD online as well. What we're trying to do is reward healthy choices, to help you understand your health, improve it, and really importantly, to partner with your physician so that you're not going at it alone. And we're going to do that by giving you an incentive. And the incentive, if you look at that dollar sign, that's the incentive. We're going to pay you to do it. We're going to pay you to engage in healthy activities. So, every HealthyU plan comes with an HIA, a health incentive account. A lot of this I'm repeating from the video, but so much the better. An HIA account. As an individual, you have the ability to earn $500. As a family, you can earn $1,000. And that's your whole family. That's you, your spouse, your children. Any children over the age of 18 can log on and do any of the online activities. And if they're under 18, they can still earn points through
well visits
and checkups and things like that. And it's funded by UPMC. It's our money. There's about 150 or so activities you can do, such as the My Health questionnaire. The video touched on that. If you go online, you take the questionnaire, we'll give you $100 into your HIA account. If you'd have a biometric screening, we'll give you $50. Preventive screenings, well visits, $100. Flu shots, $50. If you engage in some of the health coaching programs, if you just enroll in the program, $50. If you completed 100, and for the follow-up, another 25. This is just a small example of the many of the activities you have available to you. Our recommendation is to start with the My Health questionnaire. It's easy. You can do it today. You can go home tonight and do it. Log on to the website. If you don't already have a password and a logon ID, set one up, take it. We'll give you $100 for doing it. What also happens with the questionnaire is that once your information is input, the HealthyU program will feed up to you customized activities for you, depending on your conditions, your own personal conditions. So, how it works. The combined medical and pharmacy deductible beginning January 2014 will be $750 for individual, $1,500 for the family. Thing to keep in mind, and we'll talk about this a little bit also, is it is a combined medical and pharmacy. Pharmacy will be subject to the deductible just like any other medical service. Preventive care, as always, covered at 100%. As UPMC receives a bill or a claim comes in, the first thing we will do, we will look and see if you have anything in your health incentive account. Have you earned anything? If you have, we'll draw from that account and apply it towards your claim. It will then look to see if you have anything in your health reimbursement account. Now the HRA, I just wanted to mention, you earn the HIA money. The HRA money is seeded in there for you already. And the conference has been very generous in supplying that money. That money is coming from the conference. Just to sort of help in the transition and smooth the transition. So it'll check the HIA account. We will check the HRA account. Once the money is drawn out, once it's extinguished, that's when you will begin to receive your bills. Reward dollars are available to pay once the claims have posted. Funds pay automatically for copays, coinsurance, and deductibles. As I said, you don't have to do anything. We do it all. We do administratively, we do it. You're the ones that have to earn the money. HIA funds roll into the next plan year up to 2 times the deductible. Not the HRA money, the HIA money. If you earn that money, and if you don't spend it, it'll roll over next year. So you can accumulate your HIA money up to 2 times the deductible. So, for example, you go to your physician, you go to the doctor, and the bill comes in, we'll automatically check your accounts, HIA and HRA. Draw the money from that, and if we exhaust that money, the remaining balance is billed directly to you. Think of the HIA balance, or think of the HIA account as a bucket. It's a bucket you can fill with money. You don't have to. You don't have to, but we would recommend that you do. At the pharmacy, I mentioned the pharmacy will be subject to the deductible, just like the medical is. So when you go into your pharmacy, you present your ID card. The pharmacist at the counter, Giant Eagle or so, has access to your accounts real time. So they'll draw the money from the accounts at that point. The available funds are automatically applied, and any remaining balance is billed directly to you. Now, I mentioned that up front, that pharmacy is subject to the deductible. But once pocket maximum, the copays go away. There are no pharmacy copayments after you've met your out-of-pocket maximum. That's
actual cost or copays?
For copays. It's covered at 100%. Now, there's a slight change in the copay amounts. Generic copays, I think, were 10. They dropped to 8. The preferred and the non-preferred brands have gone up to 38 and 76. Also, for the folks in the audience, in your booklets, in the section labeled Schedule of Benefits, I believe, you'll find a grid that looks like this. It's a detailed grid of the HealthyU plan. It may be nice just to review it for reference. No real page, but there's it's the second section, Summary of Benefits, yellow page, Summary of Benefits, and then the next page is a grid that looks like this. It just helps sometimes to see it. Any activity you do online, a health risk assessment, coaching programs, give us about a week before we'll post that money into your account. Any activity that's claims-based, physicals, preventive screenings, flu shots, etc., give us about 2 weeks to post that money, give the physician time to send the bills in and so forth. Now, the program begins in January, but you can begin doing these activities now. UPMC has a 90-day look back. You could leave the meeting today. You could go take the HRA, the health risk assessment, and you'll get credit for that. So that come day 1, January 1st, you'll have that money. Now, since it's before the effective date, and we'll talk about some of the reporting that you have, but you won't be able to see that in your account. You won't be able to log on and see that money in your account until the plan shifts to the HealthyU plan effective in January.
So this is the main part of the website. I work a little more on the wellness side of things, and this health plan, as you're already seeing, has a lot of wellness built into it. So My Health Online is kind of your landing zone, where you want to go to for everything. My Health Central would be the tab that you would press to get to most of your actual healthy activities that you want to go into, as far as the health coaching, the My Health questionnaire, any online programs, anything like that you'd want to access. When first setting up your account, it is like a banking website because there's some fairly secured information on this website. So you have your member ID number, you need to have the last 4 of your social security number, and some of your basic demographics. When you go to enter your information, you have to enter a few security questions, so when you go to log back in, if you forget your ID or forget your username or password, you can find it again. And I want to put a little caveat out there that one of the most important things is remembering the answers to your 3 security questions. I know, we laugh, right? But I've helped people for a while now, get back into this account or go take the questionnaire, and they're like, oh, I already created an account, so we go back in, they forgot their username. Okay, you can click on there, forgot username. If you don't know your security question, you're stuck. Then we're calling member services, getting special, things unlocked, things reset. So as long as you remember those 3 things, or those 3 questions, you're good to go. You can get back in, you can reset your password, you can get your user ID if you forget it. When you create your password, it is a little bit complex. You need to have a capital, lowercase, 8 digits, and all this information will be on the website. I'm just throwing it out there so you hear it a little bit more than once, and when you go to see it again, you'll kind of remember. Here's the list of activities. So after you get into My Health Online, and you're in, Health Central, Health Tools, we're underneath right now, or Healthy Activities. In that area, this is the list that Ed was referring to as far as once you take the questionnaire, this gets organized and kind of shifted around according to your needs. All right, you're not necessarily your interests, but what you need to do. If you need to eat better, it's going to have nutrition information on there. If you need to get some more physical activity, it'll have physical activity information on there. If you're past due for different annual exams, all right, or preventative screenings, it's going to have those, and they'll be up towards the top, and it'll tell you the dollar amounts that they're worth. All right, so you can see that all on there. And like I said, you can start doing things now, but you're not going to see the dollar amounts right now. So that's why the reference page, that yellow page you have right now, would be a good thing to look at to know how much money you'll be earning. Member services, the health coaches, everybody knows you're in this situation where you can start early, but just like you, they can't see it either. Until you're switched over completely in January, they're not going to be able to see how much money you've earned at that point. So, at least until January, you're going to kind of have to keep track of it on your own, all right, in that regard. Now, on the website, you'll still see that you've done some things. All right, it'll let you know that, but you're not going to see the dollar amounts attached to it. So here's your list of activities. Even though it prioritizes them, most important, and then kind of going down, you can choose whatever activities you want, to be honest. You could go down to the bottom of the list and find something easy that you just wanted to get your feet wet and just, try it out a little bit, and then go back to the top and get something done that maybe is a little more higher priority for you. In this area, starting in January, this is what My Health Central is going to look like to you. All right, so this would be when you first log in, you click on My Health Central, it's going to show you this. All right, so if you have a family plan right now, you'll see how many family members are in there, completed activities, HIA funds that are available. So how many reward dollars are available to you, what you've earned so far. You can click on Find Your Account Balance, all right, to see what you've done. As we get a little bit further, I'll show you a little more detail on that. And then it still, again, is going to give you some recommended activities on that same thing. So it'll keep kind of pushing you to the things that you should be engaging in, all right, according to your questionnaire along with some claims data. Spending summary, similar to a bank account summary or statement. When you scroll down through this, it's going to show you. You can see you did your health risk assessment, you got $100. You had a medical claim right here that was $75, it took it out. So that way that's how you had that money deducted, so you can track this to make sure you're on the same page with us and everybody's tracking the same thing. Also, it's another area to check to see, hey, I went and had preventative blood screening done, but I don't see it on there. You know that your provider hasn't billed it to us yet. We're not trying to wait on you or anything like that. We need the provider to give us the information, so it pops up here. Explanation of benefits. You know, one important thing, if you don't like getting the big packet of explanation of benefits at home, on the website you can opt out and just get them electronically, and they'll basically just post them to the website, so then you can see them there. So you don't. I know everybody keeps those in a safe place when they get mailed to them. Nobody makes it over to the circular file by any means. So that would be a nice area to kind of store that, so you know you have it there. Not to backtrack a little bit, but I know we talked about a lot of things are automatic. You don't have to do anything administratively. Everything gets pulled up. You do have in your packet right now or in your hands one handout that's a submission form. Your dental and vision is not with UPMC. So to get the credit for something like dental or vision, you need to complete that form and submit it, and then we'll get it entered in for you. So that's, we don't have any way to know that you did it, so that's our way to still give you those, healthy incentive dollars for it. Just showing you a little bit more detail. This might be another area to find a little bit more detail as far as what you've had done. You can see how much money's been applied to your deductible and where you're at with your out-of-pocket max and different information like that. So it's another important information, even outside of the wellness, to keep you informed. I know you saw on the video it showed the mobile app, and I really talked about this in the last group to everybody, but the mobile app is a great thing to get on your phone. All right, you don't even have to log in, and you can search for providers, to look for different, urgent cares, find a physician or PCP. Also, it can become your ID card. So if you don't have it in your pocket and you go somewhere, it's on that. Use your same username and login that you would create on this online account. And it's very nice for that to kind of keep track of things. It has a lot of good information on there. And that is my part. The one other thing I'll go over while I'm still kind of going to is the yellow paper you have lists a bunch of different activities you can do and how much money they're worth. The My Health questionnaire, I know you've heard it a bunch of times and you'll probably keep hearing it. It's one of the best things for you to start off and get done. It's a time-sensitive activity. So I know you have a 90-day look back right now, so if you already did something in the beginning of October, you'll get that credit. But moving forward, once January hits, your timeline starts as far as 90 days for the questionnaire. So if you procrastinate a little bit and you go past your 90 days after January, then you only get $50 for that questionnaire. So you kind of lose out on $50 of UPMC money by waiting to complete that questionnaire. So you want to do that as early as possible, get it done. You can see how much the health coaching programs are worth. Condition management, so if you have diabetes, high blood pressure, high cholesterol, you can work with a nurse, case manager, and you can get paid for doing that, just to learn more about your disease. All right? If you have a son or daughter that has that, has diabetes, you can do that program to help learn and educate yourself to help better take care of them. If you're not ready to do a full program, one of the items, the first one on the back, is Coach on Call. Great thing if you're just looking to kind of dip your foot in the water a little bit and learn a little bit about nutrition or physical activity or stress management, whatever area you're looking to just kind of find out just a little bit more about and talk to a health coach about it. You don't have to do a full program. It's a one-time phone call, and you get $25 for it. There is a individual max and a family max on that one. I believe it's 4 phone calls for you, and then it would be 8 for a family, so you get $100 or a max of $200 for a family on that one. With the incentives too. Biometric screening. If you get a blood screening done for blood glucose, along with a lipid profile, LDL, HDL, and they do that test on you, that's automatically going to trigger, and that's one that carries over for 3 years. So if you did it now, you would get credit for it for this benefit year, and then for 2 more years after that. So it rolls over, and that's automatic. You don't have to do it because it's just recommended that once every 3 years to get that credit.
Just a final run-through. The plan operates basically the same way the plan does now. It's a PPO. You are responsible for the first set. If you're an individual, you're responsible for your deductible of $750. You have to pay all of that as of today. But now you have the HIA account and the HRA account to help you do that. After you've met that deductible, you are responsible for 20% coinsurance up until the out-of-pocket maximum. which is for a individual 1,000, and that's on the sheet. For the family, 2,000. That out-of-pocket maximum includes the deductible. That's a bit of a distinction from how it operates right now. So, you're responsible for the deductible. Use your accounts to pay it. You're responsible for the 20% co-insurance. You can use your accounts to pay that as well, up to the out-of-pocket maximum. At that point, you're free and clear. You're covered at 100%. And that includes the pharmacy copay.